Now, the glomerular filtration rate is very important to us, and we cannot do without it. So every patient we see, we think that may have chronic kidney disease, we have to do blood tests and urine tests. So we start what you call the screening process. We do a screening process by doing urine tests and blood tests to find out if the patient has any form of chronic kidney disease and the stage of the chronic kidney disease. Now, like I said earlier, based on the stage of the chronic kidney disease, we have to prepare the patient. Now, if the stage is, for example, stage 4, we are anticipating that the patient will move from stage 4 to stage 5 soon. So we have to prepare the patient for some form of renal replacement therapy. The renal replacement therapy includes some form of treatment like dialysis or kidney transplant. Now, to diagnose chronic kidney disease, like I said, we have to do the screening, but to have a complete diagnosis of what is chronic kidney disease, we have to do urine tests, we have to do blood tests, and we have to do imaging, for example, ultrasound. Within the urine test, we do a simple urinalysis, which can give us an idea about if there is any protein in the urine or any blood in the urine or the specific gravity in the urine. So it gives us information about if the patient is dehydrated, if the protein will let us know if there's chronic kidney disease or any form of the cause that it can orientate us about some causes of the chronic kidney disease. We do the blood test in form of, like I said, BUN, blood urea nitrogen, give us an idea if it's elevated, and also we do what you call the creatinine, which is a breakdown of muscle protein in the body. So if there's an increase in the BUN and also an increase in the creatinine, by using that figure, we have an idea, after we calculate it, that the patient has chronic kidney disease and as such need follow-ups and other form of treatment. So this is the importance of screening the patient and doing a diagnosis test like the urine test and the blood test. Also, we do imaging in forms of, for example, ultrasound. Ultrasound will help us to see the structure of the kidney, the size of the kidney, and the location of the kidney. If we find that the kidney size is less than 9 centimeters, it gives us an idea that the patient may have already chronic kidney disease. And also we look at a specific structure of the kidney we call the cortex. And if the cortex size is less than 1 centimeter, we also know that the patient has chronic kidney disease. And based on the chronic kidney disease, like I said earlier, we can determine the form of treatment for the patient. So this is where we are at with chronic kidney disease. So like I said, we spoke a little bit about what is chronic kidney disease. We know the epidemic of chronic kidney disease is worldwide. It's affecting the entire population. And also we know that screening is very important to capture somebody who has chronic kidney disease. Chronic kidney disease, as we know, is increasing worldwide. We do know that there are approximately 850 million of people living with chronic kidney disease, and also approximately 2 million of individuals who are receiving form of treatment for the end-stage renal disease in form of dialysis. In Jamaica currently, there are approximately 300,000 individuals living with chronic kidney disease, with approximately 10 to 12% of the population. Out of such number, about 1,000 plus individuals are currently receiving treatment in form of hemodialysis. Because of that, it is, and the number of patients with chronic kidney disease is increasing, we find that there's a burden when it comes to patients paying their own treatment. Because of that burden, from 2019, the Chase Fund has provided hemodialysis machines to all the institutions or hospitals in Jamaica, approximately 50 dialysis machines. Not only that, but Chase Fund help or contribute by giving patients individual grants to ensure that individuals get their treatment on a timely manner on a weekly basis. Because normally hemodialysis is done either 2 or 3 times per week. And as such, we would like to give Chase Fund a big thank you for such wonderful work that they are doing, and to continue doing such wonderful work and effort, to continue the effort of trying to not only providing funds for treatment, but also to help us to educate the population about what is chronic kidney disease and how we should try to decrease the number of patients with chronic kidney disease, try to control the numbers of chronic kidney disease. So we thank you, Chase, for doing such a wonderful work for us here in Jamaica. Thank you.